Good morning, students. My name is Professor Cayo. Welcome to your first day of clinical. Now that I've told you a little bit about myself, I want to hear a little bit about you. So if everyone can go around the room, tell me your name, something about you that we wouldn't know, and what your goals are for this semester. So let's go over the agenda for this morning. We're going to be reviewing the Meyers clinical policies as well as the hospital and institution policies. In terms of our clinical policies, students must arrive on time each morning to clinical and be in a full uniform. Next on our agenda is to do the unit scavenger hunt. So it's really important that you're aware of your surroundings. So here are the things that I'd like you to look for during the scavenger hunt. The EKG, the tube station, the nourishment room, the crash cart, the weight scale, glucometer, where your patient's bed alarms are, where are their call bells, the clean utility room, the dirty utility room, the Pyxis and medication room, the nurse's station, equipment and lift devices, staff rooms, and staff lounges. Continuing on with pre-conference, let's look at your assignment for today. In this week's lecture, you focused on skin integrity and pressure injuries. So with your assignment today, let's focus on skin assessments for your patients. We will review their Braden scales and their risk for pressure injuries. So it's very important that everyone participates in our pre- and post-conference discussions. That being said, let's talk a little bit about risk for pressure injury and tell me what you've learned so far. All right, Gina, this is your assignment for today. You have Mr. Jones in room 1. So please find your nurse, Angela, and get a report from her. What do you do after you get a report?
I would go into the patient's room, introduce myself by my name and title, and then check their patient identifiers, their name and their date of birth.
Very good. So once you do that, I encourage you to go in and do your head-to-toe assessment. Once that's complete, I'll come around and you can report your findings to me.
Okay. Professor Cayo? I did my assessment.
Yeah.
I assisted Nurse Angela with the dressing change, and I even documented the pressure injury and her dressing change in a soap note like you told me to.
Excellent.
I don't know what to do now.
Well, Gina, let's look at your patient's chart. I understand that you have a care plan that you should be working on. So let's review the nursing diagnoses and the plan for this patient. And let's also review the past history and see if we can come up with a few nursing diagnoses of our own and see if we can start evaluating whether or not the plan was effective.
Oh, okay.
Now let's begin our debriefment and post-conference. Gina, tell us a bit about your patient today using your S-bar.
Okay. Miss Jones is a 74-year-old female who was admitted 2 days ago with the diagnosis of...
So instructors, if you ever find that you continue to have downtime or you need to kind of add in some information during post-conference, you can utilize this sunflower diagram. So I'm not a real artist, but I think it's helpful for students in kind of reaffirming the content that they learned in lecture and helping them to really apply it in the clinical setting. So with the sunflower diagram, you have your sun here, which would be the pathophysiology of a disease. And your disease would actually be inside here, the bud. And so we're looking at pressure injuries. So for pressure injuries, you just have the students draw out the sun, and then under assessment, because we're using the nursing process here, they would talk about what are some key assessment findings or assessments to make for patients who are at risk for pressure injuries. So they can talk about frail elderly adults. They can talk about being male or female gender, if that's a risk factor. They can talk about being hospitalized here, and they can also discuss the Braden scale. The next piece in the nursing process is diagnosis. So they would use nursing diagnosis, and they need to be NANDA approved, so either risk for skin integrity or risk for injury. So our plan would be to really set up a goal for our patients to ensure that they don't have any further skin breakdown or they have improved skin integrity. And our intervention would be Q2 hour turning and positioning, utilizing a appropriate bed for the patient, getting them out of bed and ambulating. And our evaluation would be whether or not our plan worked. So I hope you find this helpful and the students find it helpful, again, to be used during the downtime and just to help students really apply some of the content from classroom. So I hope this video was helpful for you in trying to outline what a clinical day would look like. If you have any other questions, feel free to reach out to your course coordinators or anyone in simulation, and we're happy to help you in terms of guiding you towards what a clinical day should look like. I hope this is helpful to you, and we hope that you have a wonderful semester.